Question 1. The risk matrix shows a moderate likelihood of unauthorized access to patient records within Aveanna Healthcare's electronic health system due to outdated access control protocols. Which of the following implementation challenges should be prioritized to mitigate this risk in accordance with U.S. healthcare regulations? Option A. Conducting a one-time review of existing access logs and updating the password policy to require longer passwords. Option B. Deferring significant security upgrades until the next budget cycle to manage immediate operational costs. Option C. Implementing a comprehensive multi-factor authentication system and conducting mandatory annual security awareness training for all staff. Option D. Relying on the IT department to monitor system access and address any suspicious activity as it arises. The correct answer is C. Implementing a comprehensive multi-factor authentication system and conducting mandatory annual security awareness training for all staff. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates within a highly regulated environment. Ensuring compliance with patient privacy laws, such as HIPAA in the United States, is paramount. The risk matrix highlights a potential vulnerability in data security, which, if mishandled, could lead to significant financial penalties, reputational damage, and erosion of patient trust. The core of the challenge lies in balancing the need for operational efficiency with the absolute requirement to protect sensitive patient information. Careful judgment is required to implement solutions that are both effective and compliant. The correct approach involves a comprehensive review and enhancement of existing data security protocols, including encryption, access controls, and employee training, specifically tailored to address the identified risks. This approach is correct because it directly confronts the vulnerabilities identified in the risk matrix by implementing robust, multi-layered security measures. This aligns with the principles of data protection mandated by regulations like HIPAA, which require covered entities to implement administrative, physical, and technical safeguards to protect electronic protected health information. Proactive risk mitigation through enhanced security directly supports Aveanna Healthcare's ethical obligation to maintain patient confidentiality and comply with legal requirements. An incorrect approach would be to dismiss the findings of the risk matrix as minor, or to implement superficial changes without a thorough assessment of their effectiveness. This is incorrect because it fails to acknowledge the severity of potential data breaches and the stringent regulatory requirements for patient data protection. Such an approach could lead to noncompliance with HIPAA security rule, which mandates risk analysis and the implementation of security measures to reduce risks and vulnerabilities. It also demonstrates a lack of due diligence and ethical responsibility towards patient privacy. Another incorrect approach would be to prioritize cost savings over security by opting for the least expensive, but potentially less effective, security solutions. This is incorrect because regulatory compliance and patient data protection are not areas where cost should be the primary determinant. HIPAA requires that security measures be reasonable and appropriate, which may not always be the cheapest option. Failing to invest adequately in security can result in far greater costs down the line due to breaches, fines, and legal actions. This approach also violates the ethical principle of acting in the best interest of patients. A further incorrect approach would be to delegate the entire responsibility for addressing the risk matrix findings to the IT department, without broader organizational oversight and engagement from compliance and legal teams. This is incorrect because data security and privacy are cross-functional responsibilities within a healthcare organization. While IT plays a crucial role in implementation, the strategic direction, policy development, and oversight must involve all relevant departments to ensure comprehensive compliance and risk management. This siloed approach can lead to gaps in understanding and implementation, potentially overlooking critical regulatory nuances. The professional decision-making process for similar situations should involve a structured risk management framework. This begins with a thorough understanding of the identified risks and their potential impact. Next, it requires consulting relevant regulatory frameworks, e.g., HIPAA in the U.S., to understand specific compliance obligations. Then, a multidisciplinary team should collaborate to develop and evaluate potential solutions, considering their effectiveness, cost, and regulatory alignment. Finally, the chosen solution should be implemented, monitored, and regularly reviewed to ensure ongoing compliance and adaptation to evolving threats and regulations. Question 2. The risk matrix shows a moderate likelihood of unauthorized access to patient records within Aveanna Healthcare due to potential gaps in employee training and access control management. Which of the following implementation strategies best addresses this identified risk in compliance with U.S. healthcare regulations? Option A. Implement a comprehensive, multifaceted approach that includes enhanced technical safeguards like encryption, stricter role-based access controls, regular and mandatory employee training on data privacy and security protocols, and periodic internal audits of access logs. Option B. Conduct a one-time review of current access policies and update them based on the lowest cost-effective solutions available, deferring further security enhancements until a critical breach occurs. Option C. Rely exclusively on the security certifications of third-party vendors who handle patient data, assuming their compliance will adequately protect Aveanna Healthcare's information. Option D. Increase the organization's investment in advanced firewall technology and intrusion detection systems to fortify the network perimeter against external threats. The correct answer is A. Implement a comprehensive, multifaceted approach that includes enhanced technical safeguards like encryption, stricter role-based access controls, regular and mandatory employee training on data privacy and security protocols, and periodic internal audits of access logs. Explanation: this scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The risk matrix highlights potential vulnerabilities, and the challenge lies in implementing controls that are both effective and compliant with applicable laws and ethical standards. A failure to adequately address these risks can lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach involves a comprehensive review and enhancement of existing data security protocols, including robust access controls, encryption, and regular employee training on HIPAA compliance and data handling best practices. This is justified by the Health Insurance Portability and Accountability Act, HIPAA, which mandates specific safeguards for protected health information. 5. Adhering to HIPAA privacy and security rules is not merely a legal obligation, but an ethical imperative to safeguard patient confidentiality and prevent unauthorized disclosure or misuse of sensitive data. An incorrect approach of simply increasing firewall strength without addressing internal access controls or employee training fails to meet regulatory requirements. HIPAA mandates a multi-layered security approach, and focusing solely on external threats ignores the significant risk of insider threats or accidental breaches due to lack of awareness. This approach is ethically deficient, as it prioritizes a superficial technical fix over comprehensive patient data protection. Another incorrect approach of relying solely on vendor security certifications without internal verification is also professionally unacceptable. While vendor certifications are important, Aveanna Healthcare retains ultimate responsibility for the security of patient data it handles. A failure to conduct due diligence and implement internal oversight mechanisms to ensure vendor compliance with HIPAA standards constitutes a regulatory failure and an ethical lapse in safeguarding patient information. A further incorrect approach of prioritizing cost savings over necessary security upgrades, even when risks are identified, is a direct violation of both regulatory mandates and ethical responsibilities. HIPAA requires that covered entities implement reasonable and appropriate security measures, which may incur costs. Prioritizing financial gain over patient data security is a serious ethical breach and a clear regulatory noncompliance. Professionals should employ a risk-based decision-making framework that begins with a thorough understanding of the identified risks, as presented in the risk matrix. This framework involves assessing the potential impact and likelihood of each risk, identifying relevant regulatory requirements, such as HIPAA in the U.S. healthcare context, and then developing and implementing controls that are both effective and compliant. Regular review and auditing of these controls are essential to ensure ongoing effectiveness and adherence to evolving regulatory landscapes. Ethical considerations, particularly patient privacy and data confidentiality, must be paramount throughout this process. Question 3. Benchmark analysis indicates that Aveanna Healthcare is exploring partnerships with external data analytics firms to improve operational efficiency and identify trends in patient care outcomes. Considering the regulatory framework governing healthcare providers in the United States, Which of the following approaches best ensures compliance with patient privacy laws when sharing data for these purposes? Option A. Share patient data only after obtaining explicit written consent from each individual patient for the specific analytics project. Option B. Share aggregated patient data that has been summarized but not formally de-identified according to regulatory standards. Option C. Share raw patient data with the analytics firms, relying on their internal security protocols to protect information. Option D. Share anonymized and de-identified patient data that meets HIPAA standards for de-identification. The correct answer is D. Share anonymized and de-identified patient data that meets HIPAA standards for de-identification. Explanation. This scenario presents a professional challenge because it requires an understanding of how Aveanna Healthcare, as a healthcare provider, must navigate the complex landscape of patient privacy and data security within the specific regulatory framework governing its operations in the United States. The core of the challenge lies in balancing the need for operational efficiency and data utilization with the stringent requirements of federal laws designed to protect sensitive patient information. Careful judgment is required to ensure compliance, maintain patient trust, and avoid significant legal and financial repercussions. The correct approach involves implementing robust data anonymization and de-identification techniques before any data is shared or used for analytical purposes beyond direct patient care. This aligns with the Health Insurance Portability and Accountability Act, HIPAA privacy rule, which permits the use and disclosure of de-identified health information for purposes such as research, public health activities, and healthcare operations, provided the de-identification process meets specific standards. This approach prioritizes patient privacy by removing direct and indirect identifiers, thereby mitigating the risk of re-identification and unauthorized access. An incorrect approach would be to share raw patient data with third-party analytics firms without adequate safeguards. This directly violates HIPAA security rule, which mandates the protection of electronic protected health information, E5, from unauthorized access, use, or disclosure. Sharing raw data without proper de-identification or a business associate agreement (BA) that outlines specific security obligations would expose Aveanna Healthcare to significant penalties, including fines and reputational damage. Another incorrect approach would be to assume that internal data analysis is exempt from privacy regulations. While internal use for treatment, payment, or healthcare operations is generally permitted, any analysis that involves sharing data outside of direct care teams or for purposes not explicitly covered by HIPAA-permitted uses and disclosures still requires adherence to privacy and security standards. Failing to de-identify data, even for internal research or quality improvement initiatives, could still pose a privacy risk if not managed appropriately. Professionals should employ a decision-making framework that begins with identifying the purpose of data use. If the purpose extends beyond direct patient care, the next step is to determine the applicable regulations, in this case, U.S. federal healthcare regulations like HIPAA. Then, assess the data's sensitivity and the potential risks associated with its use or disclosure. Implementing appropriate controls, such as de-identification, obtaining patient consent where necessary, or establishing secure data sharing agreements should be prioritized. Continuous training and auditing of data handling practices are also crucial to ensure ongoing compliance and ethical data stewardship. Question 4. Governance review demonstrates potential inconsistencies in Aveanna Healthcare's patient record management processes that may not fully align with current federal healthcare regulations. Which of the following actions should Aveanna Healthcare prioritize to address these findings? Option A. Initiate a comprehensive audit of all patient record management protocols, identify specific areas of noncompliance, and develop a targeted remediation plan in consultation with legal and compliance experts. Option B. Immediately implement a new, simplified record-keeping system across all facilities to reduce administrative burden and associated costs. Option C. Defer action on the findings until the next scheduled operational review, assuming the inconsistencies are minor. Option D. Focus on staff training for general data privacy, without investigating the specific nature of the identified record management inconsistencies. Correct answer is A. Initiate a comprehensive audit of all patient record management protocols, identify specific areas of noncompliance, and develop a targeted remediation plan in consultation with legal and compliance experts. Explanation: scenario analysis. This scenario is professionally challenging because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. A governance review revealing potential noncompliance requires immediate and careful judgment to balance operational efficiency with legal and ethical obligations. The challenge lies in identifying the root cause of the identified issues and implementing corrective actions that are both effective and compliant with the relevant regulatory framework. Correct approach analysis. The correct approach involves a thorough investigation into the specific nature of the identified compliance gaps. This includes understanding the scope of the issue, its potential impact on patient care and data security, and the underlying reasons for the noncompliance. Following this, a remediation plan must be developed and implemented, which may involve policy updates, staff training, and system enhancements. This approach is correct because it directly addresses the identified governance issues in a structured, compliant manner, prioritizing patient safety and regulatory adherence, which are paramount in the healthcare industry. This aligns with the principles of good corporate governance and the specific requirements of healthcare regulations, such as those governing patient data and quality of care. Incorrect approach is analysis. An approach that focuses solely on immediate cost-cutting without understanding the compliance implications is incorrect. This fails to address the root cause of the governance issues and could lead to further, more serious violations, potentially resulting in significant fines, reputational damage, and harm to patients. Disregards the ethical imperative to provide safe and compliant care. An approach that involves ignoring the findings of the governance review, assuming they are minor or will resolve themselves, is also incorrect. This demonstrates a disregard for established governance processes and regulatory oversight. It exposes Aveanna Healthcare to significant legal and financial risks and undermines the trust placed in the organization by patients, regulators, and stakeholders. An approach that involves implementing superficial changes without a deep understanding of the compliance gaps is incorrect. This approach may appear to address the issue, but fails to rectify the underlying problems, leaving Aveanna Healthcare vulnerable to continued noncompliance and potential future breaches. It lacks the rigor required for effective governance and risk management in a regulated industry. Professional reasoning. Professionals at Aveanna Healthcare should adopt a systematic approach to governance reviews. This involves 1. Acknowledging and prioritizing the findings of the review. 2. Conducting a detailed root cause analysis of any identified compliance gaps. 3. Consulting with legal and compliance experts to understand the specific regulatory implications. 4. Developing and implementing a comprehensive remediation plan with clear timelines and accountability. 5. Establishing ongoing monitoring and evaluation mechanisms to ensure sustained compliance. This structured decision-making process ensures that actions taken are both effective in addressing the identified issues and fully compliant with all applicable laws and regulations. Question 5. Upon reviewing a patient's care plan at Aveanna Healthcare, a home health aide identifies a potential modification that they believe would significantly improve the patient's comfort and mobility based on a technique observed in a different healthcare setting. The aide is confident this change is safe and beneficial. What is the most appropriate course of action for the home health aide to take? Option A. Proceed with the modification after consulting with the patient's family, who have expressed similar concerns about the patient's comfort. Option B. Delay implementing the modification until further research can be conducted to confirm its efficacy and safety within the specific context of Aveanna Healthcare's patient population. Option C. Implement the modification immediately to enhance patient comfort and mobility, as the aide is confident in its safety and benefit. Option D. Document the proposed modification and submit it to the immediate supervisor or clinical lead for review and approval before any changes are made to the care plan. Correct answer is C. Implement the modification immediately to enhance patient comfort and mobility, as the aide is confident in its safety and benefit. Explanation. This scenario presents a professional challenge for an employee at Aveanna Healthcare due to the critical nature of patient care and the regulatory environment governing healthcare providers. The challenge lies in balancing the immediate need for patient comfort and safety with the strict adherence to established protocols and regulatory requirements. Careful judgment is required to ensure that any deviation from standard practice, even with good intentions, does not inadvertently compromise patient well-being or violate compliance standards. The correct approach involves a thorough understanding and application of Aveanna Healthcare's internal policies, which are designed to align with relevant healthcare regulations. This approach prioritizes patient safety by ensuring that any proposed change is reviewed and approved by the appropriate personnel, such as a supervisor or a designated clinical lead, before implementation. This ensures that the change is not only beneficial to the patient, but also compliant with all legal and ethical obligations, including those related to patient care standards and documentation. An incorrect approach that involves unilaterally making a significant change to a patient's care plan without proper authorization is professionally unacceptable. This failure violates the principle of accountability and can lead to serious consequences, including patient harm if the change is not medically sound or if it conflicts with other aspects of the care plan. Furthermore, it bypasses established quality control mechanisms designed to protect both patients and the organization. Another incorrect approach, which is to delay reporting a potential improvement due to uncertainty about the process, is also professionally problematic. While caution is understandable, prolonged inaction when a patient's comfort or care could be enhanced, and when the process for seeking approval is clear, can be seen as a failure to act in the patient's best interest. It also misses an opportunity to contribute to the continuous improvement of care delivery within Aveanna Healthcare. A third incorrect approach, which is to implement a change based solely on anecdotal evidence from other settings, without verifying its applicability and safety within Aveanna Healthcare's specific operational and regulatory context, is a significant ethical and regulatory lapse. Healthcare practices must be evidence-based and compliant with the specific guidelines and regulations applicable to Aveanna Healthcare, not just general industry trends. The professional reasoning framework for similar situations should involve a clear understanding of the organization's policies and procedures, a commitment to patient-centered care, and a proactive approach to seeking guidance and approval for any proposed changes. Professionals should always ask, is this change aligned with Aveanna Healthcare's policies? Does it comply with all relevant regulations? Is it in the best interest of the patient's safety and well-being? If there is any doubt, seeking clarification from a supervisor or appropriate department is the most responsible course of action. Question 6. Governance review demonstrates that Aveanna Healthcare's admissions department is facing increased pressure to admit patients rapidly due to high demand. A scenario arises where a potential patient requires immediate home health services, but the insurance verification process is taking longer than anticipated. The admissions coordinator is considering admitting the patient based on a verbal confirmation from the referring physician that the patient is covered. To avoid delaying care, which of the following approaches best adheres to regulatory compliance for Aveanna Healthcare? Option A. Admit the patient immediately based on the referring physician's verbal assurance of coverage and initiate the full insurance verification process concurrently. Option B. Admit the patient and bill the services to the patient directly, with the understanding that the patient will seek reimbursement from their insurance provider later. Option C. Proceed with the admission after obtaining a written commitment from the referring physician's office to expedite the full insurance verification and documentation within 48 hours. Option D. Delay the admission until the complete insurance verification and all necessary documentation are finalized and approved, even if it means delaying patient care. The correct answer is C. Proceed with the admission after obtaining a written commitment from the referring physician's office to expedite the full insurance verification and documentation within 48 hours. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for patient care with the stringent regulatory requirements governing healthcare providers like Aveanna Healthcare. The pressure to admit a patient quickly can lead to overlooking critical compliance steps, potentially resulting in significant legal and financial repercussions, as well as reputational damage. Careful judgment is required to ensure that all necessary documentation and approvals are obtained without unduly delaying essential services. The correct approach involves a thorough review of the patient's medical records and insurance verification before admission, ensuring all regulatory requirements are met. This proactive stance aligns with the principles of patient safety and regulatory adherence. Specifically, It upholds the spirit and letter of regulations that mandate proper patient assessment, eligibility confirmation, and documentation to prevent fraud, abuse, and ensure appropriate resource allocation. This approach prioritizes compliance as a foundational element of quality care delivery. An incorrect approach that bypasses the standard verification process to expedite admission, even with good intentions, fails to comply with established healthcare regulations. This could lead to admitting patients who are not eligible for services under their insurance plans, resulting in claim denials and potential financial penalties for Aveanna Healthcare. Furthermore, it undermines the integrity of the admission process and could expose the company to risks associated with improper billing and documentation. Another incorrect approach that relies solely on verbal assurances from the referring physician without independent verification is also professionally unacceptable. While physician referrals are important, regulatory frameworks require documented evidence and independent confirmation of eligibility and medical necessity. This reliance on informal communication creates a significant compliance gap and leaves Aveanna Healthcare vulnerable to audits and investigations. The professional decision-making process for similar situations should involve a clear understanding of the applicable regulatory framework, such as those governing Medicare, Medicaid, and private insurance billing and admissions. Professionals should be trained to identify potential compliance risks and to follow established protocols for patient intake. When faced with pressure to expedite a process, the decision-maker must pause, assess the compliance implications, and consult with compliance officers or legal counsel if there is any doubt about the correct procedure. The ultimate goal is to provide timely and appropriate care while rigorously adhering to all legal and ethical obligations. Question 7. The control framework reveals that a client of Aveanna Healthcare has requested a specific type of medical equipment that is not currently stocked by the company and is not on the approved vendor list, but the client insists it is the only equipment that will adequately meet their specific medical needs. What is the most appropriate course of action for the Aveanna Healthcare employee to take? Option A. Immediately approve the client's request and procure the non-standard equipment to ensure client satisfaction and immediate patient care. Option B. Politely inform the client that the requested equipment cannot be provided as it is not on the approved vendor list or stocked by Aveanna Healthcare and offer no alternatives. Option C. Agree to the client's request but make a note in the patient's file that the equipment was provided outside of standard procedure without seeking further approval. Option D. Consult with a supervisor or the compliance department to explore the possibility of an exception, research alternative compliant equipment, or investigate the feasibility of adding the requested equipment to the approved list, while keeping the client informed of the process. The correct answer is A. Immediately approve the client's request and procure the non-standard equipment to ensure client satisfaction and immediate patient care. Explanation. This scenario presents a professional challenge because it requires an Aveanna Healthcare employee to navigate a potential conflict between a client's request and established company policy, which is underpinned by regulatory compliance. The employee must exercise sound judgment to ensure patient safety and adherence to legal and ethical standards without alienating the client. The core of the challenge lies in balancing the immediate needs of the patient with the long-term implications of policy deviations. The correct approach involves a thorough understanding of Aveanna Healthcare's policies and relevant healthcare regulations, followed by clear, empathetic communication with the client. This approach prioritizes patient well-being and regulatory adherence by seeking an approved alternative that meets both the patient's needs and compliance requirements. Specifically, it involves consulting with a supervisor or designated compliance officer to explore policy exceptions or alternative solutions that are permissible under the law and company guidelines. This ensures that any action taken is documented, justifiable, and does not expose Aveanna Healthcare or its employees to legal or ethical repercussions. An incorrect approach would be to immediately agree to the client's request without proper review. This failure stems from a lack of adherence to internal control frameworks and potentially violates healthcare regulations concerning patient care protocols and documentation, bypasses necessary oversight, and could lead to unsafe practices or noncompliance with payer requirements. Another incorrect approach is to dismiss the client's request outright without exploring alternatives. This demonstrates a lack of empathy and a failure to recognize that client needs can sometimes be met through creative, compliant solutions. It risks damaging the client relationship and failing to provide optimal care within the established framework. A third incorrect approach is to agree to the request but fail to document the deviation or seek proper authorization. This creates a significant compliance risk, as unapproved deviations can lead to audit findings, penalties, and a breakdown in the integrity of the company's control framework. Professionals should approach such situations by first actively listening to and understanding the client's request and the underlying need. They should then consult internal policies and relevant regulations to determine the feasibility and compliance of the request. If the request appears to conflict with policy or regulations, the next step is to engage with supervisors or compliance departments to explore compliant alternatives or seek formal approval for any deviation. Throughout this process, maintaining open and professional communication with the client is crucial, explaining the rationale behind any decisions, and working collaboratively towards a solution that prioritizes patient safety and regulatory adherence. Question 8. Examination of the data shows that a recent billing submission for a patient receiving home health services from Aveanna Healthcare may contain an inaccurate billing code for a specific therapy session. The clinical notes appear to support the service provided, but the selected code might not fully align with the nuances of the therapy as described. Option A. Terminate services to the patient to avoid any further billing complications related to this specific instance. Option B. Initiate a comprehensive review of the patient's clinical documentation and the submitted billing code, consult relevant CMS coding guidelines, and correct the billing code if a discrepancy is confirmed, ensuring all changes are properly documented. Option C. Immediately resubmit the original billing claim without further investigation, assuming the initial submission was correct. Option D. Ignore the potential discrepancy and proceed with billing as submitted, as the clinical notes generally support the service. The correct answer is B. Initiate a comprehensive review of the patient's clinical documentation and the submitted billing code, consult relevant CMS coding guidelines, and correct the billing code if a discrepancy is confirmed, ensuring all changes are properly documented. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for patient care with the regulatory obligation to ensure proper documentation and billing practices. Aveanna Healthcare, as a healthcare provider, operates under strict federal regulations, particularly concerning Medicare and Medicaid billing. Failure to adhere to these regulations can result in significant financial penalties, reputational damage, and even exclusion from federal healthcare programs. The core of the challenge lies in identifying and rectifying potential billing errors without compromising patient safety or creating undue administrative burden. Careful judgment is required to distinguish between minor documentation oversights and systemic issues that could lead to fraudulent billing. The correct approach involves a thorough review of the patient's chart and the submitted billing codes, followed by a proactive correction of any identified discrepancies. This demonstrates a commitment to accurate record-keeping and compliance with the Centers for Medicare and Medicaid Services (CMS) guidelines, which mandate that all billing must accurately reflect services rendered. By initiating a review and correction process, Aveanna Healthcare upholds its ethical responsibility to patients and its legal obligation to the government. This approach mitigates risk by addressing potential issues before they are discovered during an audit, thereby preventing penalties and maintaining program integrity. An incorrect approach that involves ignoring the potential discrepancy or simply resubmitting the original claim without investigation would be a significant regulatory and ethical failure. This would violate CMS requirements for accurate billing and could be construed as an attempt to defraud federal healthcare programs. Another incorrect approach, such as immediately terminating services to the patient due to a documentation issue, would be ethically questionable and potentially violate patient care obligations, while also failing to address the root cause of the billing problem. Furthermore, a flawed approach that involves making arbitrary changes to documentation or billing without a clear basis or proper procedure could lead to further inaccuracies and increased compliance risk. Professionals should employ a systematic decision-making process that prioritizes accuracy, compliance, and patient well-being. This involves 1. Identifying the potential issue and its implications. 2. Consulting relevant regulatory guidelines e.g. CMS manuals HIPAA. 3. Conducting a thorough and objective review of the facts. 4. Implementing corrective actions based on findings and regulatory requirements. 5. Documenting all steps taken and the rationale behind them. 6. Seeking guidance from compliance officers or legal counsel when necessary. Question 9. Assessment of the potential impact of implementing a new AI-driven patient monitoring system at Aveanna Healthcare, focusing on how to ensure compliance with all applicable federal and state healthcare privacy regulations and ethical patient care standards before deployment. Option A. Rely solely on the AI system, vendors' privacy and security certifications, proceeding with implementation without conducting an independent assessment of the system's compliance with Aveanna Healthcare's specific operational context and regulatory obligations. Option B. Focus the assessment primarily on the technical capabilities and cost-effectiveness of the AI system, with a secondary, brief review of privacy implications to ensure minimal disruption to the implementation timeline. Option C. Prioritize the immediate deployment of the AI system to gain operational efficiencies, assuming the vendor's compliance documentation is sufficient and addressing any privacy concerns only if they arise post-implementation. Option D. Conduct a thorough impact assessment that includes a detailed review of the AI system's data handling protocols, potential security vulnerabilities, and the process for obtaining informed patient consent for data usage, aligning with HIPAA and relevant state laws. The correct answer is D. Conduct a thorough impact assessment that includes a detailed review of the AI system's data handling protocols, potential security vulnerabilities, and the process for obtaining informed patient consent for data usage, aligning with HIPAA and relevant state laws. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The need to assess the impact of a new technology requires a thorough understanding of these regulatory obligations, particularly concerning data security and patient consent. A hasty or incomplete assessment could lead to significant legal penalties, reputational damage, and a breach of trust with patients and regulatory bodies. The correct approach involves a comprehensive impact assessment that prioritizes patient privacy and regulatory compliance. This means meticulously evaluating how the new technology will handle protected health information. 5. Ensuring it aligns with the Health Insurance Portability and Accountability Act, HIPAA, and any relevant state-specific privacy laws. It requires identifying potential risks to data security, developing mitigation strategies, and establishing clear protocols for patient consent regarding the use of their data with the new technology. This proactive and detailed evaluation is essential for maintaining Aveanna Healthcare's commitment to ethical patient care and legal adherence. An approach that focuses solely on the potential operational efficiencies without a parallel assessment of privacy and security risks is fundamentally flawed. This overlooks the critical legal and ethical obligations under HIPAA, which mandate robust safeguards for PHI. Failing to conduct a thorough risk analysis and implement appropriate controls could result in data breaches, leading to substantial fines and legal repercussions. Another incorrect approach would be to proceed with implementation based on vendor assurances alone, without independent verification. Healthcare providers have a responsibility to conduct their own due diligence to ensure third-party vendors meet regulatory standards. Relying solely on a vendor's claims without independent validation exposes Aveanna Healthcare to significant compliance risks if the vendor's technology or practices fall short of regulatory requirements. Finally, an approach that delays or minimizes the patient consent process for data usage with the new technology is also problematic. While HIPAA outlines specific consent requirements, ethical best practices and some state laws may necessitate more explicit or broader consent, especially when introducing new data handling methods. Failing to obtain appropriate consent can lead to patient dissatisfaction and potential legal challenges. Professionals should employ a structured decision-making framework that begins with identifying all relevant regulatory requirements, e.g., HIPAA, state privacy laws. This is followed by a comprehensive risk assessment of the proposed technology, focusing on data privacy, security, and patient rights. Developing and implementing mitigation strategies and ensuring appropriate consent mechanisms are in place are crucial next steps. Finally, Ongoing monitoring and periodic reassessment are necessary to maintain compliance in a dynamic regulatory environment. Question 10. Which approach would be most appropriate for Aveanna Healthcare to adopt when considering the integration of a new cloud-based electronic health record system to ensure compliance with patient privacy regulations? Option A. Prioritize the speed of implementation and cost-effectiveness over detailed privacy and security reviews. Option B. Proceed with system implementation based on the vendor's assurances of compliance, with minimal internal review. Option C. Rely on existing, general IT security policies to govern the handling of patient data within the new system. Option D. Conduct a comprehensive privacy and security impact assessment to identify potential risks and develop mitigation strategies before system implementation. The correct answer is D. Conduct a comprehensive privacy and security impact assessment to identify potential risks and develop mitigation strategies before system implementation. Explanation. This scenario presents a professional challenge for Aveanna Healthcare employees due to the sensitive nature of patient data and the legal obligations surrounding its protection. Navigating the complexities of HIPAA, Health Insurance Portability and Accountability Act, requires a thorough understanding of privacy rules and the potential consequences of breaches. Careful judgment is essential to ensure compliance and maintain patient trust. The correct approach involves a proactive and comprehensive assessment of potential impacts on patient privacy and data security before implementing any new technology or process. This aligns with the core principles of HIPAA, which mandate that covered entities implement safeguards to protect protected health information. 5. Specifically, it reflects the security rules requirement for risk analysis and risk management, ensuring that potential vulnerabilities are identified and addressed. By conducting a thorough impact assessment, Aveanna Healthcare demonstrates a commitment to safeguarding patient information, thereby mitigating legal risks and upholding ethical responsibilities. An incorrect approach that focuses solely on the perceived efficiency gains without considering privacy implications would fail to meet HIPAA requirements. This oversight could lead to unauthorized access or disclosure of PHI, resulting in significant penalties, reputational damage, and loss of patient confidence. Another incorrect approach that relies on informal or ad hoc measures for data protection would also be professionally unacceptable. HIPAA mandates specific administrative, physical, and technical safeguards. A lack of structured and documented security protocols leaves the organization vulnerable to breaches and noncompliance. Finally, an approach that prioritizes cost savings over robust security measures would be ethically and legally unsound, as it directly compromises the fundamental right to patient privacy. Professionals at Aveanna Healthcare should employ a decision-making framework that begins with identifying potential risks to patient data. This should be followed by a thorough evaluation of existing safeguards and the implementation of new measures as dictated by a formal impact assessment. The process should involve relevant stakeholders, including IT security, legal counsel, and compliance officers, to ensure all aspects of data protection are considered. Regular review and updates to security protocols are also critical to adapt to evolving threats and regulatory changes. Question 11. Implementation of a new cloud-based electronic health record system at Aveanna Healthcare requires careful consideration of its impact on patient data privacy and regulatory compliance. Which of the following approaches best ensures Aveanna Healthcare meets its obligations? Option A. Conduct a thorough impact assessment involving legal, compliance, IT, and clinical teams to identify and mitigate risks to patient data privacy and regulatory adherence before full implementation. Option B. Delegate the entire responsibility for assessing and ensuring compliance to the IT department, assuming they possess all necessary expertise. Option C. Prioritize the speed of implementation to gain competitive advantages, addressing any potential privacy or compliance issues as they arise post-launch. Option D. Proceed with implementation based on the vendor's assurances of compliance with all relevant healthcare regulations, assuming the technology is inherently secure. The correct answer is A. Conduct a thorough impact assessment involving legal, compliance, IT, and clinical teams to identify and mitigate risks to patient data privacy and regulatory adherence before full implementation. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of health records. The introduction of new technology, while potentially beneficial, necessitates a thorough impact assessment to identify and mitigate risks before implementation. This requires a careful balancing of operational efficiency with legal and ethical obligations. The correct approach involves a comprehensive impact assessment that proactively identifies potential risks to patient data privacy and security, as well as compliance with relevant healthcare regulations. This assessment should involve all relevant stakeholders, including IT, legal, compliance, and clinical staff, to ensure a holistic understanding of the technology's implications. The justification for this approach lies in the regulatory framework governing healthcare data, such as HIPAA in the United States, which mandates robust security measures and privacy protections. A proactive assessment ensures Aveanna Healthcare can implement appropriate safeguards, train staff, and develop policies to prevent breaches and maintain compliance, thereby avoiding significant legal penalties, reputational damage, and erosion of patient trust. An incorrect approach would be to proceed with implementation without a formal impact assessment. This failure to conduct due diligence exposes Aveanna Healthcare to significant regulatory violations. For instance, if the new technology inadvertently creates vulnerabilities in patient data storage or transmission, it could lead to a breach of HIPAA privacy and security rules. This would result in potential fines, corrective action plans, and mandatory breach notifications, all of which are costly and damaging. Another incorrect approach would be to rely solely on the vendor's assurances of compliance without independent verification. This oversight ignores Aveanna Healthcare's ultimate responsibility for safeguarding patient data. The vendor's compliance does not absolve the healthcare provider of its own legal and ethical duties. Professionals should approach such decisions by first understanding the specific regulatory landscape applicable to Aveanna Healthcare, e.g., HIPAA, state-specific privacy laws. They should then adopt a risk-based methodology, prioritizing assessments that identify the most critical potential impacts on patient privacy, data security, and regulatory compliance. This involves engaging a multidisciplinary team to review the technology's functionalities, data flows, and potential points of failure. The decision-making process should be iterative, allowing for adjustments to the implementation plan based on the findings of the impact assessment, ensuring that compliance and patient well-being are paramount. Question 12. Compliance review shows that Aveanna Healthcare is experiencing a temporary shortage of qualified pediatric home health nurses in a specific region, impacting the ability to staff all scheduled patient visits. A patient's regular nurse is unexpectedly out on sick leave, and their care plan requires specialized skills. What is the most appropriate course of action for Aveanna Healthcare to ensure continuity of care and regulatory compliance? Option A. Assign a licensed practical nurse, LPN, with general pediatric experience but no specific training in the patient's complex needs, with the expectation that the patient's family can provide additional guidance. Option B. Inform the patient's family that services will be temporarily suspended until the regular nurse returns or a permanent replacement is found, without offering alternative care options. Option C. Assign a less experienced RN from a different service line to the patient, assuming they can quickly adapt to the pediatric specialization with minimal on-the-job training and support. Option D. Immediately seek a replacement registered nurse, RN, who possesses the required pediatric specialization and has undergone Aveanna Healthcare's standard credentialing and onboarding process, even if it means a slight delay in the next scheduled visit. Correct answer is A. Assign a licensed practical nurse, LPN, with general pediatric experience but no specific training in the patient's complex needs, with the expectation that the patient's family can provide additional guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing patient care needs with the operational realities of staffing and resource allocation within a healthcare setting like Aveanna Healthcare. The core tension lies in ensuring that patient safety and quality of care are not compromised due to staffing shortages, which can be a common issue in the home healthcare industry. Judgment is required to determine the most ethical and compliant course of action when faced with a situation where a qualified clinician is unavailable. Correct approach analysis. The correct approach involves prioritizing patient safety and regulatory compliance by seeking a qualified replacement clinician who meets all necessary credentialing and competency requirements. This aligns with the fundamental ethical obligation of healthcare providers to deliver safe and effective care. Specifically, this approach adheres to regulations that mandate appropriate staffing levels and the qualifications of personnel providing patient care. It also upholds the professional standard of ensuring that any substitute clinician is fully vetted and capable of meeting the patient's needs as outlined in their care plan. Incorrect approaches analysis. One incorrect approach involves assigning a less experienced or unqualified staff member to the patient's case without adequate supervision or support. This directly violates regulations concerning the competency of healthcare providers and poses a significant risk to patient safety. It demonstrates a failure to uphold the duty of care and could lead to adverse patient outcomes, regulatory penalties, and damage to Aveanna Healthcare's reputation. Another incorrect approach is to delay care or leave the patient without necessary services due to the staffing gap, without proper communication or alternative arrangements. This can be considered patient abandonment or a failure to meet contractual obligations for service provision. Regulations often stipulate requirements for continuity of care and notification procedures when services are disrupted. A third incorrect approach is to falsify documentation or misrepresent the qualifications of the staff member assigned to the case. This is a serious ethical and regulatory violation, constituting fraud and deceit. It undermines the integrity of patient records, compromises patient safety, and can lead to severe legal and professional consequences for both the individual and Aveanna Healthcare. Professional reasoning. Professionals facing such a dilemma should first consult Aveanna Healthcare's internal policies and procedures regarding staffing shortages and emergency replacements. They must then assess the immediate patient needs and the potential risks associated with any proposed solution. The decision-making process should prioritize patient safety and regulatory adherence above all else. This involves proactive communication with supervisors, exploring all available qualified resources, and documenting all actions taken and decisions made. If no immediate qualified solution is available, the process must include clear communication with the patient or their representative about the situation and the steps being taken to resolve it, in accordance with applicable regulations. Question 13. During the evaluation of a new administrative assistance onboarding process at Aveanna Healthcare, which approach best ensures compliance with patient privacy regulations and company policy while enabling the employee to perform their essential job functions? Option A. Limiting the employee's access to non-patient-related administrative tasks for the first month, with no access to patient data until all advanced compliance certifications are obtained. Option B. Allowing the new employee to shadow experienced staff members and observe their interactions with patient data without granting direct system access for the initial 3 months. Option C. Granting immediate, full access to all patient electronic health records and related systems, with a general overview of privacy policies provided later in the week. Option D. Providing comprehensive training on HIPAA and Aveanna Healthcare's data security protocols, followed by granting role-based access to only the specific patient information and systems necessary for the administrative assistant's duties. Correct answer is C. Granting immediate, full access to all patient electronic health records and related systems, with a general overview of privacy policies provided later in the week. Explanation. This scenario presents a professional challenge because it requires balancing the company's operational needs with the ethical and regulatory obligations to protect patient information. Aveanna Healthcare, as a healthcare provider, is subject to stringent regulations regarding patient privacy and data security. The core of the challenge lies in determining the appropriate level of access and data handling for a new employee without compromising patient confidentiality or violating applicable laws. Careful judgment is required to ensure that the employee receives the necessary training and access to perform their role effectively, while adhering to all legal and ethical standards. The correct approach involves a phased onboarding process that prioritizes security and compliance. This includes providing access to training modules on patient privacy regulations, such as HIPAA in the U.S. context, and company-specific policies before granting access to sensitive patient data. Access should be role-based, meaning the employee only receives permissions necessary for their specific job functions. This approach is correct because it directly aligns with the principles of data minimization and the need-to-know basis for accessing protected health information. 5. As mandated by regulations like HIPAA, It ensures that Aveanna Healthcare fulfills its legal duty to safeguard patient privacy and prevent unauthorized disclosure of PHI. An incorrect approach would be to grant immediate and broad access to all patient records upon the employee's first day. This fails to adequately train the employee on privacy protocols and significantly increases the risk of accidental or intentional data breaches. This violates the fundamental principles of patient privacy and data security, potentially leading to severe regulatory penalties, reputational damage, and loss of patient trust. Another incorrect approach would be to delay access to any patient information until the employee has completed extensive, non-role-specific training that goes far beyond what is necessary for their immediate duties. While training is crucial, an excessive delay without providing access to the information needed to learn the job can hinder operational efficiency and employee development, and may not be the most effective way to impart practical knowledge about data handling in a healthcare setting. The goal is to provide access in a controlled and compliant manner, not to withhold it unnecessarily. The professional decision-making process for similar situations should involve a systematic evaluation of the employee's role, the type of data they will access, and the relevant regulatory requirements. This includes consulting company policies, seeking guidance from compliance officers or legal counsel, and implementing a tiered access system. Professionals should always prioritize patient privacy and data security, ensuring that all access and training protocols are documented and regularly reviewed for compliance. Question 14. Risk assessment procedures indicate that Aveanna Healthcare is considering the introduction of a new telehealth service line to expand its patient reach. While market analysis suggests strong patient demand and significant revenue potential, there are concerns about the specific state and federal regulations governing such services, particularly concerning patient data privacy and reimbursement protocols. Which of the following approaches best aligns with Aveanna Healthcare's commitment to regulatory compliance and patient safety? Option A. Proceed with the launch of the telehealth service immediately to capitalize on market demand, addressing any regulatory issues that may arise post-launch. Option B. Rely on the company's existing general compliance policies, assuming they are sufficient for this new service line without specific investigation. Option C. Conduct a comprehensive review of all applicable federal and state telehealth regulations, including HIPAA, state licensing requirements, and Medicare/Medicaid reimbursement guidelines, to identify and address potential compliance gaps before launch. Option D. Adopt the operational and regulatory practices of a competitor that has already launched a similar telehealth service, assuming their model is compliant. The correct answer is A. Proceed with the launch of the telehealth service immediately to capitalize on market demand, addressing any regulatory issues that may arise post-launch. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The conflict arises when a new service line, potentially lucrative, is being considered without a thorough understanding of its regulatory implications. This requires a careful balancing act between business development and compliance, demanding a judgment call that prioritizes patient safety and legal adherence over immediate financial gain. The correct approach involves a comprehensive regulatory review and risk assessment before committing resources or launching the new service. This proactive stance ensures that Aveanna Healthcare understands all applicable federal and state laws, including those related to patient data, like HIPAA, billing practices, and the scope of services permitted. By identifying potential compliance gaps early, the company can either modify the service to meet regulatory requirements or decide not to proceed, thereby avoiding significant legal penalties, reputational damage, and harm to patients. This aligns with the ethical obligation to provide safe and compliant care and the legal imperative to adhere to all healthcare regulations. An incorrect approach that focuses solely on market demand and potential revenue overlooks critical compliance obligations. This could lead to violations of patient privacy laws, fraudulent billing practices, or offering services outside of licensure, all of which carry severe consequences. Another incorrect approach that relies on anecdotal evidence or the practices of less regulated entities fails to acknowledge the specific legal landscape governing Aveanna Healthcare's operations. This demonstrates a lack of due diligence and a disregard for the established regulatory framework. Finally, an approach that prioritizes speed to market over thorough due diligence risks launching a service that is non-compliant, potentially exposing the company and its patients to significant risks. Professionals in this situation should employ a decision-making framework that begins with identifying the core objective, launching a new service, and then systematically assesses the regulatory environment. This involves consulting with legal and compliance experts, conducting thorough research into relevant statutes and guidelines, and performing a detailed risk analysis. The decision to proceed should only be made after all identified risks have been mitigated or accepted with a clear understanding of their implications, and all regulatory requirements have been met. Question 15. Performance analysis shows that Aveanna Healthcare's patient intake process has become increasingly time-consuming, leading to longer wait times for new patients seeking home healthcare services. To address this, a proposed optimization strategy involves significantly reducing the number of required documentation fields and shortening the duration of initial patient consultations. Which of the following approaches best balances efficiency gains with Aveanna Healthcare's commitment to patient safety and regulatory compliance? Option A. Introduce a new, complex digital intake system without adequate staff training or a pilot testing phase, expecting it to automatically resolve all efficiency issues. Option B. Implement a phased approach to process optimization, starting with streamlining administrative tasks that do not directly involve clinical assessment or patient interaction, while simultaneously gathering data on the impact of these changes on patient wait times and satisfaction. Option C. Focus solely on reducing the number of staff involved in the intake process to decrease labor expenses, assuming that remaining staff can manage the workload with the proposed time savings. Option D. Immediately implement the proposed strategy of reducing documentation fields and consultation times to expedite the intake process and reduce operational costs. The correct answer is B. Implement a phased approach to process optimization, starting with streamlining administrative tasks that do not directly involve clinical assessment or patient interaction, while simultaneously gathering data on the impact of these changes on patient wait times and satisfaction. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient safety and ensure quality of care. Process optimization, while beneficial for efficiency, must never compromise these core responsibilities. The challenge lies in balancing operational improvements with the absolute priority of patient well-being and adherence to regulatory mandates. Careful judgment is required to identify optimization strategies that enhance service delivery without introducing risks or violating established standards. The correct approach involves a systematic review of existing processes, identifying bottlenecks or inefficiencies that do not negatively impact patient care or regulatory compliance. This approach prioritizes data-driven insights and stakeholder feedback to inform changes. Specifically, it aligns with the ethical imperative to provide competent and safe care, as well as regulatory requirements that often mandate continuous quality improvement and adherence to established protocols. The focus on patient outcomes and compliance ensures that any optimization efforts are sustainable and responsible. An incorrect approach that focuses solely on cost reduction without considering the impact on patient care or regulatory adherence is ethically unsound and potentially illegal. Such an approach could lead to understaffing, reduced access to necessary services, or shortcuts that compromise safety, violating the fundamental duty of care owed to patients. Another incorrect approach that bypasses established quality assurance protocols or regulatory reporting mechanisms undermines transparency and accountability. This failure to adhere to mandated oversight processes can result in undetected errors, patient harm, and significant legal repercussions for Aveanna Healthcare. Furthermore, an approach that prioritizes speed of implementation over thorough risk assessment and validation could inadvertently introduce new problems or exacerbate existing ones, leading to a decline in service quality and potential noncompliance. Professionals should employ a decision-making framework that begins with a clear understanding of Aveanna Healthcare's mission, values, and the regulatory landscape. This involves identifying the specific objectives of process optimization, assessing potential impacts on patient care and compliance, and consulting relevant internal policies and external regulations. A robust risk assessment should precede any implementation, and continuous monitoring and evaluation are essential to ensure that optimization efforts remain aligned with ethical and regulatory standards. Question 16. Stakeholder feedback indicates that Aveanna healthcare scheduling practices may be leading to extended wait times for patients and potential burnout among clinical staff. Which of the following approaches best addresses this feedback while adhering to healthcare best practices and regulatory expectations? Option A. Dismiss the feedback as anecdotal and focus resources on other operational priorities, assuming that current scheduling practices are efficient enough. Option B. Implement a blanket reduction in appointment availability across all service lines to decrease the number of scheduled patients, without analyzing the impact on patient access or staff capacity. Option C. Conduct a comprehensive review of current scheduling protocols, analyze patient wait time data and staff workload metrics, and engage with both patients and staff to gather specific examples and identify root causes before implementing any changes. Option D. Immediately implement a new, more rigid scheduling system to enforce stricter appointment durations and reduce perceived wait times, without further investigation into the underlying causes of the feedback. The correct answer is C. Conduct a comprehensive review of current scheduling protocols, analyze patient wait time data and staff workload metrics, and engage with both patients and staff to gather specific examples and identify root causes before implementing any changes. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The feedback highlights a potential disconnect between operational efficiency and patient-centered care, which can have significant regulatory and ethical implications. Careful judgment is required to balance the need for efficient operations with the fundamental right to privacy and quality care. The correct approach involves a thorough, data-driven investigation into the root causes of the stakeholder feedback. This means gathering specific examples, identifying patterns, and assessing the impact on patient care and regulatory compliance. This approach is best professional practice because it aligns with the principles of continuous quality improvement and accountability mandated by healthcare regulations. Specifically, it addresses potential violations of patient rights and data privacy laws by proactively identifying and rectifying issues. It also demonstrates a commitment to ethical patient care by taking feedback seriously and acting upon it. An incorrect approach that focuses solely on immediate cost-cutting without understanding the underlying issues would be professionally unacceptable. This would fail to address the root causes of stakeholder dissatisfaction, potentially leading to ongoing patient care deficiencies and regulatory noncompliance. Could also violate ethical obligations to provide high-quality care. Another incorrect approach that involves dismissing the feedback as isolated incidents without proper investigation would also be professionally unacceptable. This ignores potential systemic problems that could lead to broader patient harm or regulatory breaches. It demonstrates a lack of due diligence and a disregard for patient well-being and the company's ethical responsibilities. A third incorrect approach that involves implementing broad, unverified changes without understanding the specific concerns raised by stakeholders is also professionally unacceptable. This could lead to unintended negative consequences, further impacting patient care and operational efficiency, and may not address the actual issues identified in the feedback. It shows a lack of analytical rigor and a failure to engage in a responsible problem-solving process. The professional decision-making process for similar situations should involve a structured approach. First, acknowledge and document all feedback. Second, categorize and prioritize feedback based on potential impact and urgency. Third, conduct a thorough, objective investigation to understand the root causes. Fourth, develop and implement targeted solutions. And finally, monitor the effectiveness of these solutions and iterate as necessary. This process ensures that decisions are informed, ethical, and compliant with all applicable regulations. Question 17. The assessment process reveals that a home health aide at Aveanna Healthcare has been consistently documenting patient visits as completed when, according to patient family reports, the aide was significantly delayed or did not complete the full scope of services. This situation raises concerns regarding accurate patient care documentation and potential billing irregularities. Which of the following actions best addresses this situation in compliance with federal healthcare regulations and Aveanna Healthcare's ethical obligations? Option A. Immediately terminate the home health aide's employment and conduct a broad audit of all patient records to identify similar discrepancies. Option B. Initiate a confidential, thorough investigation into the specific allegations, reviewing the aide's documentation, patient records, and interviewing the aide and relevant supervisors, while ensuring patient care is not compromised during the investigation. Option C. Advise the patient's family that while they appreciate their feedback, the agency's internal records are considered definitive and no further action will be taken unless concrete proof of fraud is presented. Option D. Implement a new, more stringent documentation policy for all aides immediately, without investigating the specific incident, to prevent future occurrences. The correct answer is A. Immediately terminate the home health aide's employment and conduct a broad audit of all patient records to identify similar discrepancies. Explanation: this scenario presents a professional challenge due to the inherent conflict between a healthcare provider's commitment to patient care and the operational demands of a business. Aveanna Healthcare, as a provider of home healthcare services, must navigate the complex regulatory landscape governing patient safety, privacy, and quality of care, while also managing resources efficiently. The assessment process revealing potential noncompliance requires immediate and careful judgment to uphold ethical standards and legal obligations. The correct approach involves a thorough, objective investigation into the reported concerns, prioritizing patient well-being and adherence to all applicable federal and state healthcare regulations, including those specific to home health agencies. This includes reviewing patient records, interviewing relevant staff, and assessing current practices against established protocols and regulatory requirements. This approach is correct because it directly addresses the reported issues with a systematic and evidence-based methodology, ensuring that any identified deficiencies are understood in their full context and can be rectified in compliance with laws such as the Health Insurance Portability and Accountability Act, HIPAA, for patient privacy, and Medicare/Medicaid regulations for quality of care and billing. It demonstrates a commitment to patient safety and regulatory integrity. An incorrect approach would be to dismiss the concerns without proper investigation, perhaps due to time constraints or a desire to avoid disruption. This failure to investigate would violate the ethical duty to ensure patient safety and could lead to significant regulatory penalties, patient harm, and reputational damage. Another incorrect approach would be to implement immediate, sweeping changes without understanding the root cause of the reported issues. While action is necessary, a reactive, uninvestigated response could be inefficient, ineffective, and potentially create new compliance problems. Finally, an approach that focuses solely on punitive measures against staff without a comprehensive review of systemic issues would be ethically flawed and unlikely to resolve underlying compliance gaps. Professionals should employ a structured decision-making process that begins with acknowledging and documenting any reported compliance concerns. This should be followed by an objective assessment of the situation, gathering all relevant facts and evidence. Based on this evidence, a determination of the appropriate course of action should be made, always prioritizing patient safety and regulatory adherence. This process should involve consulting with compliance officers, legal counsel, and relevant operational leaders to ensure all decisions are informed and defensible. Question 18. Process analysis reveals that a home health aide at Aveanna Healthcare, while providing care to a patient, encounters an unexpected change in the patient's condition requiring immediate intervention. The aide successfully stabilizes the patient, but realizes that the electronic health record (EHR) system is temporarily unavailable due to a technical issue, preventing immediate documentation of the event and intervention. What is the most appropriate course of action for the Aveanna Healthcare home health aide in this situation, adhering to U.S. healthcare regulations and Aveanna's internal policies? Option A. Provide immediate care to stabilize the patient and then, as soon as the EHR system is restored, meticulously document the event, the intervention, and the patient's response. Option B. Wait for the EHR system to become fully operational before providing any further intervention or documentation to ensure all records are entered in real time. Option C. Focus on stabilizing the patient and then immediately contact the supervisor to verbally report the incident, with the understanding that formal documentation will be completed later. Option D. Prioritize completing a written note of the event and intervention in a secure personal notebook to be transcribed into the EHR once the system is back online. The correct answer is A. Provide immediate care to stabilize the patient and then, as soon as the EHR system is restored, meticulously document the event, the intervention, and the patient's response. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of a patient with the legal and ethical obligations of Aveanna healthcare. The core tension lies in ensuring patient safety and continuity of care while adhering to regulatory requirements for proper documentation and communication. A healthcare provider must exercise careful judgment to avoid compromising either aspect. The correct approach involves prioritizing patient safety and immediate care needs while initiating the process for proper documentation and communication. This aligns with the ethical imperative to act in the best interest of the patient and the regulatory framework that mandates accurate record-keeping and timely reporting. By ensuring the patient receives necessary care and then immediately addressing the documentation gap, Aveanna Healthcare demonstrates a commitment to both patient well-being and regulatory compliance. This proactive stance minimizes potential risks and ensures that all necessary information is captured and communicated appropriately, fulfilling the requirements of relevant healthcare regulations. An incorrect approach that focuses solely on completing the documentation before attending to the patient's immediate needs would be ethically and regulatorily unsound. This would violate the principle of patient advocacy and could lead to adverse health outcomes. Furthermore, it would likely contravene regulations that emphasize prompt assessment and treatment of patients. Another incorrect approach that involves delaying documentation until a later, less urgent time, or attempting to reconstruct the events without immediate input poses significant risks. This can lead to incomplete or inaccurate records, which can have serious implications for patient care, legal liability, and regulatory audits. It fails to meet the standard of contemporaneous documentation often required by healthcare regulations, which are designed to ensure the accuracy and reliability of patient information. Professionals should employ a decision-making framework that prioritizes patient safety and immediate clinical needs. This involves a rapid assessment of the situation, followed by the provision of necessary care. Concurrently, the professional should initiate the process of documenting the care provided and any critical observations, even if it's a preliminary note, to be followed by a more comprehensive entry as soon as feasible. This approach ensures that patient well-being is paramount while also laying the groundwork for full regulatory compliance and accurate record-keeping. Question 19. Market research demonstrates that a new federal regulation is likely to significantly increase operational costs for home healthcare providers like Aveanna Healthcare in the upcoming fiscal year. As a member of the investor relations team, you are preparing materials for an upcoming investor call. How should you address the potential financial impact of this regulation? Option A. Highlight the company's historical financial successes and focus on growth opportunities, while briefly mentioning the regulation as a minor operational challenge that will be managed. Option B. Wait to disclose the full impact of the regulation until it is officially implemented and its financial consequences are definitively quantifiable to avoid alarming investors prematurely. Option C. Emphasize the company's strong market position and competitive advantages, suggesting that these factors will largely offset any financial impact from the new regulation without providing specific details on the regulation's cost. Option D. Proactively disclose the potential negative financial impact of the new regulation, providing a clear explanation of how it may affect future earnings and operational efficiency, and outlining the strategies Aveanna Healthcare is developing to mitigate these effects. Correct answer is A. Highlight the company's historical financial successes and focus on growth opportunities, while briefly mentioning the regulation as a minor operational challenge that will be managed. Explanation. This scenario presents a professional challenge because it requires balancing the company's financial interests with the ethical obligation to provide accurate and transparent information to potential investors. The pressure to meet financial targets can create a temptation to present information in a misleading light. Careful judgment is required to ensure that all disclosures are truthful, complete, and not designed to deceive. The correct approach involves proactively disclosing the potential impact of the regulatory changes on Aveanna Healthcare's future financial performance, even if it is negative. This aligns with the principles of full and fair disclosure mandated by securities regulations, such as those enforced by the Securities and Exchange Commission, SEC, in the United States. Specifically, The SEC's Regulation SK requires companies to disclose material risks and uncertainties that could affect their business or financial condition. By providing this information, Aveanna Healthcare demonstrates a commitment to transparency and investor protection, fostering trust and maintaining the integrity of the capital markets. This proactive disclosure also allows investors to make informed decisions based on a realistic assessment of the company's prospects. An incorrect approach would be to omit or downplay the potential negative impact of the regulatory changes. This failure to disclose material information is a direct violation of securities laws and ethical standards. It misleads investors by creating an overly optimistic picture of the company's future, potentially leading them to invest based on false pretenses. Such an action could result in severe penalties, including SEC enforcement actions, fines, and reputational damage. Another incorrect approach would be to present the information in a way that is technically true but misleading through selective emphasis or omission of crucial context. This also violates the spirit of full disclosure and can be considered a form of deception, eroding investor confidence. Professionals should employ a decision-making framework that prioritizes ethical conduct and regulatory compliance. This involves 1. Identifying all material information, including potential risks and uncertainties. 2. Assessing the potential impact of this information on the company's financial performance and investor perceptions. 3. Consulting with legal and compliance departments to ensure all disclosures meet regulatory requirements. 4. Prioritizing transparency and accuracy in all communications, even when the information is unfavorable. 5. Considering the long-term consequences of any decision on the company's reputation and investor trust. Question 20. Compliance review shows that Aveanna Healthcare's current patient feedback collection methods may not fully align with data privacy regulations and internal data handling policies. Which of the following approaches best addresses this finding to ensure ongoing compliance and operational integrity? Option A. Conduct a comprehensive review of all current patient feedback processes, engaging legal and compliance departments to identify specific regulatory gaps and develop a compliant remediation plan. Option B. Classify the feedback discrepancies as minor operational inefficiencies and proceed with minor, undocumented adjustments to the existing system. Option C. Immediately implement a new, advanced feedback platform that promises enhanced data analytics capabilities, assuming it will automatically resolve any existing compliance issues. Option D. Rely on anecdotal evidence from frontline staff to make quick, informal changes to how patient feedback is managed. The correct answer is C. Immediately implement a new, advanced feedback platform that promises enhanced data analytics capabilities, assuming it will automatically resolve any existing compliance issues. Explanation. This scenario presents a professional challenge because Aveanna Healthcare, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The compliance review highlights a potential gap in how patient feedback is managed, which could have significant implications for regulatory adherence, patient trust, and operational efficiency. The core of the challenge lies in balancing the need to gather and act upon patient feedback with the absolute requirement to comply with all applicable laws and guidelines, particularly those related to data privacy and handling of sensitive information. The correct approach involves a thorough, systematic review of the current patient feedback process against established regulatory frameworks and internal policies. This approach is correct because it prioritizes a comprehensive understanding of the existing procedures and identifies specific areas of noncompliance or potential risk. By engaging relevant stakeholders, including legal and compliance departments, Aveanna Healthcare can ensure that any proposed changes are not only effective in improving patient satisfaction, but also fully compliant with all legal and ethical obligations. This methodical process minimizes the risk of future violations and demonstrates a commitment to responsible data handling and patient care, aligning with the principles of good governance and regulatory stewardship. An incorrect approach that focuses solely on immediate implementation of new technology without a prior compliance assessment would be professionally unacceptable. This failure stems from a disregard for the regulatory landscape, potentially leading to the adoption of systems that do not meet privacy standards or data security requirements. Another incorrect approach, which involves dismissing the feedback as minor or inconsequential, ignores the potential for systemic issues and the importance of patient voice in identifying operational weaknesses. This demonstrates a lack of due diligence and a failure to uphold the ethical responsibility to address patient concerns, which can erode trust and lead to more significant problems down the line. A third incorrect approach, which involves making ad hoc changes without a documented process or stakeholder consultation, risks creating further inconsistencies and compliance gaps, undermining the integrity of the feedback system and potentially violating established protocols. Professionals should approach such situations by first establishing a clear understanding of the regulatory environment governing their operations. This involves proactive engagement with compliance teams and legal counsel. When a compliance review identifies an issue, the professional decision-making process should involve a detailed impact assessment, followed by the development of a remediation plan that is both effective and compliant. This plan should be reviewed and approved by relevant stakeholders before implementation, with ongoing monitoring to ensure sustained compliance and effectiveness.